Now, there's been a spike in new infections of the novel coronavirus in the Western Cape. One of the hotspots outside of the Cape Metro then is the Witzenberg District, and this includes Ceres and Tulbagh. Now, 93 cases and 2 deaths have been reported in the area so far. Provincial health authorities are expecting the numbers to even increase dramatically in the coming days as they intensify their testing. 1,737 infections, 35 deaths, all in that province. Now, Provincial Health Minister Nomafrench Mbombo is visiting the Witzenberg Municipality today. Let's cross to Mariska Botha, who is in the area for us. Mariska, we're certainly hoping to get more word on what needs to be done, what measures can be done, and just how much the MEC can certainly put together in terms of intensifying testing in the area. Is that the sense you're getting to on the ground?
Arabile, it's exactly as you're saying there. We actually have the MEC for Health in the province here with us, Dr. Nomafrench Mbombo. She did arrive this morning. We're in Nduli at the moment, which is just outside Ceres in the Witzenberg Municipality. As you correctly reported, 93 cases, 2 deaths in the area. And what we're seeing now is that the cases are definitely moving away from the metros, more towards the rural areas. But to talk to us a little bit more, maybe get us a better sense of what's going on in the province, let's bring in the MEC for Health. MEC, thank you so much for joining us. First of all, why did you come to the Witzenberg District? Is there a particular reason? Is there a particular concern for you here?
Yes, it's one of the hotspots, increase in the local transmission that is outside the metro. Actually, it's the second biggest in terms of the local transmission outside the metro. And also the contributing factors is mostly these bushfires, clusters. We're here in Nduli. Actually, earlier today, there were about 100 cases for the whole of Witzenberg Municipality, and half of those are from this area. But noting that, because I indicated it's mostly bushfires, some of them are essential workers who might be working from the prison. We have seen the outbreak from the prison, from the supermarkets, from the private hospital, and also from the agri-processing farms. So that's where we are now. So the main reason for this is about the emergency plan. Whilst the Western Cape has got the overall plan for the province, but what is it that we can do urgently so that to contain the spread? And as you correctly indicated that the overall deaths from the Witzenberg, there actually have been 4. What is it that we can do together? I'm here with a team, also the clinicians from this area. The main important thing is about how do we intensify the isolation, because most of the cases, they are being told that they can self-isolate. Knowing this area in Nduli, there is no way that the person can be able to self-isolate completely. Yes, maybe in other areas in the Ceres, but this area it will be difficult. As you can see, the people are still roaming the streets. And number 2, the quarantine. Now we're expanding. We had one place where people can be quarantined. So it has been confirmed now. We have extended the quarantine area. Number 2, in the Witzenberg, for 24 hours, it's only the Ceres hospital that is open. After hours, there is no other facility that can open after hours. So what is it that we can do, especially if you have got almost 100 people who are positive, active cases, and then they can present with an emergency or even like a coughing and shortness of breath, and they need an oxygen. The distance from here to the Ceres, do we have a dedicated ambulance EMS? Or is there any other facility that we can open in order to accommodate the after hours, especially when the person has got the oxygen? So it has been confirmed that there is a plan where to explore to have such. And also I'm convinced that the Ceres hospital, now they do have dedicated beds, which they're still working out in addition to the isolation ones. And also the issue now, we are also busy with the community screening and testing. So what's going to happen if anyone wants to screen? Does that person have to go to the Ceres hospital, or our local primary health care facilities will be able to accommodate such? So this is all what we are looking at. And then lastly, as I indicated, that most of these cases are coming from these clusters, the agri-processing and so forth. What is the readiness? of the employers, the farmers, the shop owners, to prevent the spread. Because in one facility, for example, in prison, there were about, I think, 20-something of the cases that came out. And some of them ended up infecting the communities. What is the readiness? So we are doing all of those in order to make it a point. Also, I've met with the mayors. All the council and councillors are here. Their readiness also for the burial, for the grave, and what is it that they can contribute, because it's not only a provincial responsibility, it's a national disaster. And fortunately, the national has made a commitment to assist us with the resources as much as we need. And what is it the municipality can do? And then lastly, is there a need for the mop-up? What do we mean by the mop-up? It's about when there's an emergency, there's an outbreak, where you can be able to close all other areas temporarily, whilst you make it a point that all resources are placed here, and then you cleanse the area until you are satisfied that everyone has been taken care of, and then you open it up.
Minister, on that note, as you were saying, you're speaking about mop-up, but as we understand from the President, every province will have the ability to decide on which level it will be, and it will be the same for the districts. Has a decision been taken, first of all, on the Western Cape? Will it go to level 4 on Friday? And then second of all, an area like this where you have a concern, which is your greatest concern outside of the metro, will they remain at a level 5 or will they be allowed to go to a level 4?
Okay, just for correction, it's only the National Command who can determine the levels. Within the provinces, they can make alerts in regard to the hotspots. A hotspot can be a street, can be a building, can be a district or a sub-district. Already for us, our submission to the National Health is about the metro, the whole of the metro, the Cape Wineland, specifically Witzenberg, is part of the areas that we need to look at, same as in the Garden Route, the Mosselbaai, because we have seen quite a large amount of the local transmission. So indeed, Witzenberg is one that we identify where we have to up our game, and everywhere, everyone, even if it's still level 4, but there will still be many restrictions that I've just made now in terms of the movements, in terms of ensuring even when the sectors open. Because remember, this is the agri area. People need food, food security. So you cannot close down the farming, you cannot close down the agriculture. But how do we ensure we work together? We assist them that these are the kind of the interventions that you need to prevent those. In the afternoon, I am going to one of the farms. They invited me, the Dutoy farms, which were also one of that are affected, where they said that come and seat yourself, have a conversation with the workers. And also we are open, actually, even for us to reprimand us if need be. And remember that those kind of the farms, the farming group, are the ones who also even initiated, they've got their own clinic, their own staff, using their own resources, which is they are already in the game that we are here to assist, make use of us. Yes, Witzenberg, because it's one of the high levels of transmission outside the metro, is part of those that you are zooming on it.
Thank you very much. That was the Health MEC in the province, Dr. Nomafrench Mbombo, telling us there that they are taking this quite seriously. And yes, this is most definitely one of the most concerning areas for them that has been alerted, including the Cape Town Metro and on the Garden Route is the areas, just confirming there with her, that they have alerted. So it's possible, if decisions are taken about levels, that those could stay at level 5. Am I correct, MEC?
Even if it could be level 4, it could be remain a hotspot and be on the level 5 of alert in terms of the restrictions.
There we go. There you had it. It could be at level 4, but in terms of the alert of the seriousness of the infections or the rate of infections in the area, it could have a serious alert out, even if it's out on level 4. So there's still some confusion. We're still going to figure that out in the coming days, how it will work when level 4 actually kicks in. But what we know for certain right now is that this is one of the areas that the Department of Health in the Western Cape is certainly concerned about, and that's why the MEC for Health is here to see for herself on the ground what is happening, and to visit one of the farms. As she said, it's one of the agriculture production areas. A lot of apples and pears come from this area, so it's definitely one of the areas of great concern for the municipality, for the province, and they will be visiting a farm later on to see how things are done there.
Mariska, please keep safe in and around the area as well. Thank you so much for that reporting. Our very own Mariska Botha